Welcome to Mentally Healthy. We're so glad you're here. We are very proud to welcome and introduce Innovative Products as the sponsor for today's video and content. IPP supports the ongoing mission of Mentally Healthy and our affiliations. As Innovative Products' tagline outlines, Mentally Healthy honors discovering the possibilities together.
Let's take a moment to relax and breathe. Today, we're going to learn and explore 10 ways COVID-19 has affected us concerning anxiety, fear, and childhood trauma. The COVID-19 pandemic has brought unprecedented challenges and changes to our daily lives, affecting nearly every aspect of our existence. It has also had a significant impact on our mental health, leading to increased anxiety, fear, and childhood trauma, among other negative outcomes. As we continue to navigate the ongoing pandemic, it's important to understand the ways in which COVID-19 has affected our mental health, and to take steps to prioritize our well-being. For many of us, the pandemic has brought new levels of anxiety and stress. The fear of contracting the virus or spreading it to others, as well as the experience of isolation and loneliness, has taken a toll on our mental health. In addition, financial stress and disruptions to daily routines have added to the challenges faced by many. Moreover, the pandemic has also led to delayed access to mental health care, which can have significant negative consequences on mental health. With the closure of non-essential services and physical distancing requirements, many people have experienced delays in accessing mental health treatment, which can exacerbate mental health problems over time. In today's video, we're going to shed more light on this subject and these areas of discussion. Join us as we explore the 10 ways COVID-19 has affected us concerning anxiety, fear, and childhood trauma. If you're ready, let's get started. Number 1. Increased anxiety and stress levels. A survey conducted by the American Psychological Association found that 78% of adults reported experiencing at least one symptom of stress during the pandemic. This is a significant increase from the pre-pandemic levels of stress reported in previous years. There are a few different factors that have contributed to this increase in anxiety and stress levels. First, the pandemic has created a sense of uncertainty and unpredictability. People are unsure about the future, and this can lead to feelings of anxiety and stress. Second, the pandemic has caused many changes to our daily lives, which can also lead to anxiety and stress. For example, many people have had to adapt to working from home, which can be a difficult transition. Others have had to juggle new responsibilities, such as homeschooling children or caring for sick family members. Third, the pandemic has caused a lot of fear and concern about the health and safety of ourselves and our loved ones. This fear can manifest as anxiety and stress, especially for those who are at higher risk or who have pre-existing health conditions. The impact of increased anxiety and stress levels can be significant. Prolonged stress can lead to physical symptoms such as headaches, muscle tension, and fatigue. It can also lead to mental health concerns, such as anxiety disorders, depression, and substance abuse. Number 2. Fear of contracting the virus. The fear of contracting the virus is a common fear among many people, especially those who are at higher risk due to age, pre-existing health conditions, or other factors. This fear can manifest as anxiety, stress, and even panic attacks. This fear can be particularly challenging because it's not just a theoretical fear, the virus is real, and the consequences of contracting it can be severe. The constant news coverage of the pandemic, including rising case numbers and deaths, can exacerbate this fear. The fear of contracting the virus can lead to several negative impacts on mental health. For example, people may become hyper-vigilant about avoiding exposure to the virus, which can lead to obsessive behaviors and avoidance of social situations. This can further increase feelings of isolation and loneliness. The fear of contracting the virus can also lead to heightened levels of stress and anxiety, which can impact overall well-being. When the body is in a state of constant stress, it can impact sleep, mood, and even physical health. To manage the fear of contracting the virus, it's important to stay informed about the latest guidance from public health officials and to take appropriate precautions, such as wearing a mask, washing hands regularly, and practicing social distancing. However, it's also important to recognize when the fear is becoming overwhelming and to seek support when needed. This might include talking to a therapist or counselor, joining a support group, or engaging in relaxation techniques such as meditation or deep breathing exercises. Number 3. Fear of spreading the virus. The fear of spreading the virus is another common fear among many people, especially those who work in essential jobs or who have regular contact with others. This fear can manifest as anxiety, guilt, and even shame. This fear can be particularly challenging because it places a heavy burden on individuals to take responsibility for preventing the spread of the virus. People may worry about unintentionally spreading the virus to others, even if they have no symptoms themselves. This fear can lead to feelings of guilt or shame, especially if someone does contract the virus and they suspect they may have passed it on to others. The fear of spreading the virus can lead to several negative impacts on mental health. For example, people may become hyper-vigilant about avoiding contact with others, which can lead to feelings of isolation and loneliness. This can further increase feelings of guilt and shame. The fear of spreading the virus can also lead to heightened levels of stress and anxiety, which can impact overall well-being. People may worry about the consequences of spreading the virus, including severe illness or even death. To manage the fear of spreading the virus, it's important to stay informed about the latest guidance from public health officials and to take appropriate precautions, such as wearing a mask, washing hands regularly, and practicing social distancing. It's also important to recognize that everyone has a role to play in preventing the spread of the virus, and to take steps to be responsible for one's actions. This might include avoiding social gatherings or crowds, staying home when feeling ill, and getting vaccinated when eligible. Number 4. Isolation and loneliness. Isolation and loneliness are significant issues that have been greatly exacerbated by the COVID-19 pandemic. With social distancing measures in place, many people have been forced to isolate themselves from friends and loved ones in order to prevent the spread of the virus. Isolation and loneliness can have a significant impact on mental health. Social isolation has been linked to a range of negative outcomes, including depression, anxiety, and poor sleep quality. Loneliness, in particular, can also have physical health implications, such as an increased risk of heart disease and stroke. Moreover, the COVID-19 pandemic has made it more difficult for people to connect with others in traditional ways. Many social activities, such as going to the movies, attending concerts or sporting events, and even simply gathering with friends and family, have been put on hold or have become more challenging to navigate due to restrictions on group gatherings. The impact of isolation and loneliness can be especially pronounced among vulnerable populations, such as the elderly, individuals with pre-existing mental health conditions, and those who live alone. For these individuals, the pandemic has increased feelings of isolation and loneliness and made it more difficult to access needed support and resources. To mitigate the impact of isolation and loneliness, it's important to find ways to stay connected with others, even while practicing social distancing. This might include video chats, phone calls, or socially distanced outdoor activities. Finding new hobbies or activities that can be done at home can also help to alleviate feelings of isolation and loneliness. Number 5. Financial stress. Financial stress is another significant way that the COVID-19 pandemic has affected people's mental health. Many people have experienced financial difficulties due to job losses, reduced work hours, or increased expenses related to the pandemic. This financial stress can be a significant source of anxiety and can contribute to a range of mental health issues. Financial stress can manifest in different ways, such as worrying about paying bills, struggling to make ends meet, or feeling uncertain about the future. This stress can lead to feelings of helplessness and anxiety, which can impact overall well-being. Research has shown that financial stress is linked to several negative mental health outcomes, including depression and anxiety. People who experience financial stress may also be at higher risk of substance abuse, poor physical health, and relationship issues. The impact of financial stress during the pandemic has been felt disproportionately by certain groups, such as low-income families, people with disabilities, and those who work in industries that have been hit hardest by the pandemic. To manage financial stress, it's important to prioritize self-care and take steps to address financial difficulties. This might include creating a budget, seeking financial assistance, or finding new sources of income. It's also important to seek support from friends, family, or a mental health professional who can provide guidance and emotional support. Many organizations are also providing financial assistance and mental health resources during the pandemic. For example, some banks and credit unions have provided support to customers who have been impacted financially by the pandemic. Mental health hotlines and crisis services are also available for those who are struggling with the emotional impact of financial stress. We provide some of those resources at the end of this video, so keep watching. Number 6. Uncertainty and loss of control. Uncertainty and loss of control are two significant ways that the COVID-19 pandemic has affected people's mental health. The pandemic has created a lot of uncertainty about the future, leading to feelings of anxiety and stress. Many people have also experienced a sense of loss of control, as the pandemic has disrupted many aspects of daily life. The uncertainty caused by the pandemic can lead to a sense of powerlessness and fear of the unknown. This can be a significant source of stress, as people may feel like they are unable to plan for the future or predict what will happen next. This uncertainty can also be compounded by conflicting information in the media, making it difficult to know what to believe or how to prepare for the future. The loss of control associated with the pandemic is related to the disruptions in daily life caused by the virus. Many people have experienced changes to their work, social lives, and daily routines, which can lead to feelings of instability and a lack of control. This loss of control can also be related to the restrictions imposed by public health guidelines, such as stay-at-home orders and limits on social gatherings. Research has shown that uncertainty and loss of control are linked to negative mental health outcomes, including depression, anxiety, and post-traumatic stress disorder. People who experience these feelings may also be more likely to engage in maladaptive coping strategies, such as substance abuse or other risky behaviors. To manage the uncertainty and loss of control associated with the pandemic, it's important to focus on what can be controlled. This might include practicing good self-care, setting personal goals, and finding ways to stay connected with loved ones. Number 7. Disruption to daily routines. The disruption to daily routines is another significant way that the COVID-19 pandemic has affected people's mental health. The pandemic has disrupted many aspects of daily life, such as work, school, socializing, and leisure activities. This disruption has led to feelings of stress, anxiety, and depression for many people. The disruption to daily routines can be particularly challenging for individuals who thrive on structure and routine. The pandemic has forced many people to work from home, which can blur the lines between work and personal time. This can lead to feelings of burnout, as people struggle to maintain a healthy work-life balance. The disruption to routines can also lead to a lack of motivation, as people may feel unsure of what to do with their time or may struggle to find a sense of purpose. Research has shown that disruptions to daily routines can have a significant impact on mental health. People who experience disruptions to their routines may be more likely to experience symptoms of anxiety and depression. They may also be more likely to engage in unhealthy behaviors, such as overeating or not getting enough exercise. To manage the disruption to daily routines, it's important to establish a new routine that works for the current situation. This might include setting a schedule for work and leisure activities, finding new ways to socialize and connect with loved ones, or exploring new hobbies and interests. It's also important to prioritize self-care and engage in activities that promote mental health, such as exercise, mindfulness, or spending time in nature. Number 8. Trauma related to illness or death. The COVID-19 pandemic has led to a significant amount of illness and death around the world, and many people have experienced trauma related to this. Trauma related to illness or death can include direct experiences with the virus, such as contracting COVID-19 or losing a loved one to the virus, as well as indirect experiences, such as witnessing the impact of the pandemic on others. Experiencing illness or death firsthand can be a traumatic experience, as it can lead to feelings of fear, anxiety, and grief. Individuals who have contracted COVID-19 may experience physical and emotional symptoms that can be difficult to manage, such as difficulty breathing, fatigue, and fever. Those who have lost a loved one to the virus may experience intense feelings of grief, as well as guilt or regret about not being able to say goodbye or not being able to provide the care that they wanted to. Witnessing the impact of the pandemic on others can also be a traumatic experience. Many people have experienced loss or illness in their community, and the constant coverage of the pandemic in the media can be overwhelming. This can lead to feelings of helplessness, hopelessness, and a sense of impending doom. Research has shown that trauma related to illness or death can have a significant impact on mental health. People who experience this type of trauma may be more likely to experience symptoms of post-traumatic stress disorder, depression, and anxiety. They may also experience physical symptoms such as headaches or insomnia. Number 9. Increased screen time. With social distancing and stay-at-home orders in place due to the COVID-19 pandemic, many people have turned to technology as a way to stay connected and entertained. This has led to an increase in screen time, which can have both positive and negative effects on mental health. On the positive side, increased screen time can be a way to stay connected with loved ones, engage in virtual social activities, and access information about the pandemic. This can help alleviate feelings of isolation and loneliness, which can have a positive impact on mental health. However, increased screen time can also have negative effects on mental health. Spending excessive amounts of time on electronic devices can lead to physical symptoms such as eye strain, headaches, and fatigue. It can also lead to emotional symptoms such as irritability, anxiety, and depression. Research has shown that excessive screen time can have a negative impact on sleep, which can lead to a range of mental health problems such as depression, anxiety, and mood swings. This is because the blue light emitted by electronic devices can disrupt the body's natural sleep-wake cycle. To manage the negative effects of increased screen time, it's important to establish healthy habits around technology use. This may include setting limits on screen time, using blue light filters on electronic devices, and taking frequent breaks to engage in physical activity or relaxation techniques. It's also important to prioritize face-to-face interactions and other forms of non-screen-based entertainment. This may include outdoor activities, reading, or engaging in creative pursuits. Number 10. Delayed mental health treatment. The COVID-19 pandemic has disrupted many aspects of daily life, including access to mental health care. With the closure of non-essential services and physical distancing requirements, many people have experienced delays in accessing mental health treatment, which can have significant negative consequences on mental health. Delayed mental health treatment can lead to a range of negative outcomes. Individuals who experience mental health problems may experience worsening symptoms over time, which can lead to a decline in overall functioning and quality of life. They may also experience increased distress and difficulty managing day-to-day tasks. Research has shown that delayed mental health treatment can have long-term negative effects on mental health. Individuals who do not receive timely treatment for mental health problems may be more likely to experience chronic or recurring mental health problems, which can be more difficult to manage over time. This can lead to increased health care costs, decreased productivity, and decreased quality of life. The COVID-19 pandemic has also led to a range of stressors that may exacerbate mental health problems, such as financial stress, social isolation, and uncertainty about the future. This has led to an increased need for mental health services during this time. To address delayed mental health treatment, it's important to prioritize mental health care as an essential service during the pandemic. This may include increasing access to telehealth services, which can help individuals access mental health care from the safety of their own homes. It may also include providing mental health care services in non-traditional settings, such as community centers or other public spaces. This concludes our video on the 10 ways COVID-19 has affected us concerning anxiety, fear, and childhood trauma. In conclusion, the COVID-19 pandemic has had a significant impact on mental health, leading to increased anxiety, fear, and childhood trauma, as well as other negative outcomes such as financial stress, disruption to daily routines, and delayed access to mental health care. The fear of contracting and spreading the virus, as well as the experience of isolation and loneliness, has taken a toll on mental health, and many people have experienced trauma related to illness or death. Please share with us your experiences in this area. Increased screen time and uncertainty and loss of control have also been a concern for mental health during the pandemic, as have disruptions to daily routines. Delayed access to mental health care has added an additional layer of stress for those who are struggling with mental health problems during this time. What have been some of your challenges? It's important to remember that we are all in this together and that seeking support is a sign of strength. By staying informed and taking steps to care for our mental health, we can continue to navigate these uncertain times and emerge stronger on the other side. Despite the challenges posed by the pandemic, it's important to prioritize mental health needs and seek help if experiencing mental health problems. This may include accessing mental health resources available online or reaching out to mental health professionals for support. By prioritizing mental health needs, we can help mitigate the negative impact of the pandemic on our mental well-being. Your friends here at Mentally Healthy support the American Psychological Association for finding a good therapist and ensuring you work with a qualified professional who has background and expertise that will benefit you and your specific needs. We are not affiliated with that organization and receive no special compensation for recommending them. We just recognize the importance of finding qualified professionals to help us when help is needed. Another great resource is also available for those that can take advantage of it. For all our viewers that reside in the United States, a hotline is available to act as an immediate response lifeline center for all suicide and crisis events. Just call or text the number 988, local rates may apply, to immediately be placed in touch with someone you can talk to. If you are a U.S. veteran or military service member, you may text the U.S. Veterans Crisis Line directly at 838-255. Both of these resources will also be placed in the description area of this video. Use these trusted resources as needed.
Well, that's all for today. Thanks so much for joining us at Mentally Healthy. If you've enjoyed our video, please like it, and consider subscribing to our channel, as we have lots of great new content in store for you. Subscribing, liking, and clicking the notification bell keeps you connected to us, and truly helps our channel grow. Here's a few other great videos from our channel you can visit right now. Until next time, stay mentally healthy.